Hello everyone and a warm welcome to our webinar exclusively for War Widows. I'm Caroline Kirsch, Communications and Events Manager at the Families of Veterans Guild, and I'm delighted to have you with us today. Before we begin today's session, and while everyone is logging on and getting settled in, I will go through a few housekeeping items. First and foremost, please be advised this webinar will be recorded. We do this to ensure that those who couldn't make it today can catch up later or share this valuable content with family and friends. Today, each panelist will provide you with a presentation during which we encourage you to engage with us. At the end of each presentation, we will have a Q&A session, so you can ask questions relevant to each presentation or share your thoughts at any time. Please use the Q&A box below to send in your queries, and we will do our best to address them. If you're joining us from our Chatswood office today, please ask our team on site to provide you with our question slips, and they will enter your questions on your behalf. So before we commence, I would like to acknowledge the traditional custodians of the many lands on which we are gathering today. I am on the lands of the Camaragal people, and I pay our respect to the elders past, present, and emerging, and extend that respect to anyone of Indigenous heritage joining us today. I'd also like to acknowledge all of those who have and continue to serve Australia as part of the Australian Defence Force. I acknowledge the families of uniformed personnel for your commitments and sacrifices that allows them to preserve and protect a peaceful Australia. So for those who have just joined us, my name is Caroline Kirsch. I am the Communications and Events Manager at the Families of Veterans Guild, and I will be facilitating this webinar today. This webinar has been designed in collaboration with the Department of Veterans Affairs, DVA, and exclusively for War Widows to understand the entitlements that are available to you with DVA. We have 4 panelists joining us today from DVA to cover specific areas. I will now introduce you to our panelists. We have Sharon Waddle, Team Leader Income Support New Claims. Sharon's role in DVA is Team Leader of the Income Support New Claim team. Her team is in charge of processing multiple different types of income support claims. Welcome, Sharon.
Thank you for having me. Good afternoon, everyone. So as Carolyn has said, I'm from the income support team. So I'll be covering the income support supplement. So just bear with me while I get this up and sharing.
Oh, not yet. Sorry, Sharon. I just introduced the panelists for this.
No worries.
My apologies. So I'll also introduce you to Jonathan Levy, who is the Director of Health Approval, Payment, RAP and Transport, commonly referred to as Director HART. Jonathan has worked many years for DVA and is currently based in the Brisbane office after commencing his DVA career in Canberra. The HART team has sections in Adelaide, Melbourne, Canberra and Brisbane. All transport team members are located in the Brisbane office. Jonathan will cover transport entitlement with us today. Welcome, Jonathan.
Thank you, Caroline.
Thank you. Thanks. We also have Melanie Kilburn, who is Assistant Director of Veterans Home Care and Contract Management. Melanie's team is responsible for the strategic management of the program to ensure client needs and expectations are met through the continual review of service arrangements. Melanie will present you today with the Veteran Home Care Program. Welcome, Melanie.
Thank you, Caroline. It's lovely to be here.
Thank you. And finally, we have Caroline Lees, who is the Director responsible for the Community Nursing Program at DVA. Caroline and her team manage the program, funding approximately 400 contracted community nursing providers to deliver in-home nursing services for veterans and their families. Welcome, Caroline.
Thanks very much, Caroline. Great to be here.
Thank you. And we will now commence with Sharon. My apologies, I didn't really clarify, but yeah, go ahead, Sharon.
No worries at all. Thank you, Caroline. Sorry about that before. So, yeah, as I was started saying before, I'm in the income support new claims team. So I will talk about the income support supplement, which you can get as part of the, well, in addition to the War Widows pension. So I'm just going to share my screen. So hopefully you can see it quite fine now. yes, so the income support supplement is just it's a regular tax-free payment from DVA that supplements your your fortnightly payment from DVA. The ISS, as we call it, the income support supplement, can only be paid to the Australian War Widows under the VEA or the wholly dependent partners under the MERCA Act. It's a means-tested pension, so it's subject to the income and assets test. So basically, who you can claim is and it needs to be a proper claim for the ISS. You must be both following Australian resident and in Australia at the time of lodging your claim. If you happen to be outside Australia at the time of the claim, you're only eligible for ISS where you were receiving a service pension or Social Security age pension prior to it being cancelled to receive the War Widows. If you are granted the War Widows under the VEA or the MERCA and receiving the service pension or the Social Security age pension prior, that cancellation will be the pension will be cancelled, and then the War Widows and the ISS will be automatically granted. If you don't have an automatic grant of the ISS, you can put in a lodgement for it. You'll receive a letter listing the income and assets used in calculating the amount of your ISS when it is granted. And if your income and assets differ to what's those advised, because we use what is currently held by the department, you should advise DVA within 14 days or 28 days if you're overseas. You cannot receive both the ISS and a service pension or Social Security age pension or any other Social Security pension or benefit. You can, however, receive family tax benefit or childcare benefit from Services Australia if you are eligible. The current amount of ISS payable to both singles and members of a couple is currently $347.60 per fortnight. The maximum rate of the ISS is indexed every March and September of each year. So the amount you receive depends on your income and your assets and whether you're partnered or single. Now, the ISS is means tested, but some widowers can receive the full rate. What counts as an income and assets? So basically income can be pensions from Centrelink or other countries. You got your superannuation, so like your DFRDB, MSBS, ComSuper, bank interest, shares. Assets can include property other than your principal home and your savings, vehicles, investments. It can be that if you are classified by an ophthalmologist as permanently blind, you can receive the maximum rate of ISS regardless of your income and assets. However, just been noted that if you were to move into residential aged care, your income would be considered for calculating the fees that you would pay there. So the benefits of receiving the ISS is that you would receive a pensioner concession card, which can entitle you to cheaper medications, discounts on transport and other services, including property rates, water charges, electricity bills, gas bills. Each state differs to what they will offer as to what the concessions are. So, and for each state, there is a list available on the DVA website. There is also, if you are renting, you may be eligible for rent assistance depending on how much rent you are paying and whether it is government rental. The way to apply for the ISS, if it was not an automatic grant, is to fill in an application of the D0529, which is the Part A, and the D0648, the Part B. We do need both parts completed completely, as Part A is talks about all your information, and the Part B is the income and assets. You can also lodge by ringing the 1-800 veteran number and asking for forms to be sent out, or visiting a DVA office and they can provide them to you. A decision that has been made, you'll get notified by letter. That will include the decision date and, if applicable, the date of grant and the amount of ISS you are to receive. Your concession card will be issued at the same time. That can normally take up to 14 days to arrive, depending on Australia Post. Your ISS may be backdated to the grant of your War Widows or wholly dependent partner payment, or negotiated to commence from the date your Social Security payment or benefits ceased, or if it's cancelled as a result of the commencement of the War Widows. ISS recipients and claimants are required to advise DVA within 14 days or 28 days if you live overseas or receive the remote area allowance of an event or change circumstances that might affect your rate of pension or payment or eligibility to receive that pension or payment. If you receive ISS at a reduced rate, you may request a reassessment of your rate of pension at any time by notifying DVA when there is a change to your circumstances. You can do this by contacting DVA by phone, email, or via my service. Is there any questions?
If anyone has any questions, feel free to pop them in the Q&A box at the bottom of the screen. I don't see any questions so far, Sharon. So we'll just give a couple of minutes just to see.
No, that's fine.
Okay, I don't see any questions for now, but we will have more time. Oh, actually, I do have questions coming in now.
Yeah.
So I have a question from someone asking, what is the War Widows pension amount?
The War Widows pension amount, I don't know the actual amount off the top of my head because that's processed by the compensation team, but I believe it's around about 1,100 a fortnight. That's just at a guess off the top of my head at the moment. I haven't looked at the rate in a fair while. My apologies for that one.
Thank you, Sharon. Another question, do you need to be receiving full ISS for rent assistance?
No, you do not. The rent assistance depends upon how much rent you're paying, and again, whether it's government rental or whether it's what they class as a private rental. That it's just dependent. Every situation is different, but you aren't entitled to rent assistance if you get through like a government rental.
Okay. Another one is from the Chatswood office. What is the cutoff amount for asset and income test for a single person?
Now, I had that. If you just bear with me, I will find that again because I had them down. So for a single person, so are they a homeowner or a non-homeowner?
Unsure.
That because that can make a difference. So basically, for our asset limits for our homeowner, the ISS can start reducing at 584,000, and it ceases at 700,000 for a homeowner.
Yep.
Whereas for a non-homeowner, it ceases. It starts reducing at 842,000, and then ceases. And my figure has disappeared off my screen. Here it is. Of I think it's 958,000.
Thank you. Now, is there a minimum age that you can apply for ISS?
No, that it's if you're on the War Widows or wholly dependent, you can apply at any time. It all just comes down to whether you're eligible with the eligibility, but the age does not take into account for that one.
Okay, perfect. Thank you. What are the limits for assets and income for single widows? We've just covered that. My apologies. Should have read those. So let me double check. I have a question that says, does this apply to DRAC widows? But unsure what this is.
I'm not sure what DRAC widows are.
Okay. Can the ISS be applied to a retirement village?
The ISS is a payment, so I'm not sure how they mean to a retirement village, whether they're meaning of whether they would get rent assistance, because I know some retirement villages, they purchase the home and then pay rent on the land.
Okay.
And again, it comes down to their entry contribution as to what was paid when they moved in there.
Okay. Okay. Let me check through some of the questions. There's quite a bit on there. There's a car. Okay. And so another question, can the ISS be additional to the War Widows pension?
Yes, it can. You can you only get the ISS as well as the War Widows. The War Widows pension is not income and asset tested, as you found, whereas the ISS is. It's like almost like a top-up payment to the War Widows pension.
Okay, thank you. Another question, a War Widow can claim ISS through my service, but not rent assistance. Is there reasons for this?
The rent assistance generally is done as part of it. So as when you're lodging the ISS claim and you're putting in that you're renting, it would automatically happen of that. If you are entitled to the rent assistance, the system would grant it. Now, if it happens to be you're already on ISS and then you move into a rental, then you can lodge the request for rental assistance. You can't do that via the My Service. You would need to ring up the department, or there is a form on the DVA website to download.
Okay, thank you, Sharon. Another question is, why is it that when a widow is on a service pension and is then granted the War Widows pension, in this situation, why is it that some cases ISS is assessed automatically and in other times it is not?
Everyone's situation is different. Now, if they're previously on the service pension and granted the War Widows pension, it should be an automatic grant, but there sometimes is glitches with the system. And this is why it's not an automatic grant. And that's when you just need to get in contact with the department and we can organise for the claim to be completed with you. And then the team would look at granting that. Okay.
Thank you. Someone confirming on behalf of her mother. So if her mother or his mother, their mother, is receiving their father's DFR DB as well as War Widows pension, does that make her ineligible for ISS?
I can't say that a yes or no, because it is actually going to come down to the amount of DFR DB that she is getting, because it is counted as income, and of course the part of the War Widows is counted as income. It's individual circumstances, but she could certainly lodge a claim to apply for it, but I can't say a definite yes or no because it's individual, the amounts.
Okay, thank you, Sharon. Another question from our Chatswood office. If I sell my house and move in with my relatives, does this affect my War Widows pension?
It would not affect the War Widows pension because that is not income and asset tested. If you're on the income support supplement, so the ISS, it could, yes, because of that is income and asset tested.
Okay. Someone is asking the form number to apply for rent assistance.
No, that's fine. I will have to come back with that one if I can, please, and I'll find that while one of the other DVA speaking and provide it at the end.
Perfect. I keep this question for the end. Thank you, Sharon. Is there a list of utility supplier who offer War Widows discounts? I'm not sure that's your area, Sharon, or do we need to call them to inquire?
Not really my area, but I do know that you would need to inquire with that utility. As I said, like there is a list on the DVA website for each different state as to what concessions may be available, because some of them are state-based, and your provider is your utility provider is always the best one to actually speak to as to whether they will accept the pensioner concession card.
Okay, thank you. Another question from someone who became a widow at 26 and took the lump sum rather than the pension, and who is now asking, is there any other financial assistance?
If it was like the DIRCA lump sum, then no, that's, from my understanding of that is we are the fortnightly. They could be, depending on if they're previous partner, so their deceased partner had QS, might be entitled to the service pension. But for the purposes of this, they aren't a widow under the VEA or the MERCA, which is where the service pension would come into. But again, that's depends on the income and assets of whether they would be eligible for the service pension.
Okay, thank you. I do have another question from the Chatswood office. Someone would like to confirm the income cut off for a single person in relation to the previous question. If you wouldn't mind reconfirming this, Sharon, that would be
No,
fantastic.
that's right. So, but previously I said the asset limits. So the income limits for a single person before the ISS starts reducing is $1,792.60. The ISS would cease when your income is $2,487.80. That is for a single.
Thank you, Sharon. Does an inheritance affect the ISS?
It could, yes, because it's going to depend on the amount the inheritance is, what you do with it. So if you put it into your bank account, it's going to be classed as a financial asset. So just a broad yes, but how it does is dependent on the amount and how you choose to use that inheritance. Okay.
One last question from the Chatswood office, and then we will move to the next presenter. Thank you, Sharon. For the ISS, most a curious question. If home is not included in the asset, why is there different levels from home owners and non-home owners?
My understanding of it is that because non-homeowners can have that, I guess, the money in the bank of where they're going to be purchasing home or look at purchasing home in a longer period of time. So that's why they're allowed to have that slightly more money within the bank. Whereas a homeowner, you're already within your principal home, and that's why it's not included. The principal home is not included in the assessment.
Okay. Thank you. Thank you, Sharon.
No
well,
worries.
thank you, everyone, for the questions. We've answered as many as we could. And thank you very much, Sharon, for the presentation. We'll come back to more questions afterwards. So, yeah, perfect. Thank you. I will now invite Jonathan to provide us with information on transport. Jonathan, I will. Thank you.
Thank you, Carolyn. That's wonderful. Good afternoon, everyone. As Karen quite rightly said before, my name's Jonathan Levy, and I'm the director of the transport, for want of a better term, I'm the director of the transport team here, and we look after all of Australia in regards to transport for veterans and war widows. We provide transport assistance in 4 ways mainly, but the first step to get through for transport assistance is that you need to be travelling for approved medical treatment within Australia. So by approved medical treatment, what we actually mean is that you pay for the treatment with your gold or your white card. So if you pay for your treatment with your gold and white card and attending your closest provider, in our guys, you'd be happy to know that we'll be able to reimburse you some costs or actually be able to provide you some transport up front. So we do provide transport in 4 separate ways. One was called our book half driver system. I'll go through all that shortly for you. Our claim reimbursement process. We also book flights for long distance travel, and we also provide an ambulance service or reimburse costs for ambulance service. So we'll just move on to the book car, please, Carolyn, if you don't mind. Thank you. So this is what we call our DVA arranged travel, and it's a book car driver service. And what that basically means is we have contracts with taxi companies all across Australia. We've got a pretty good coverage of every town and city in Australia, regions and country towns as well. So what actually occurs with the book car driver process, if you tick the boxes that are there on the, I won't go through them all because I'll bore you all to tears, but if you go through the boxes there that's on the screen, you may well be eligible for transport to and from via our book car driver service with your gold or white card. I would expect the majority of people in this room would have access to through war widows with the gold card. So if you're over 80 years of age, you can travel to all medical treatment. So whether it be a GP, a physio, to a hospital or to a specialist, we'll transport. You're eligible for the book-half driver service to go to and from all your medical treatment. If you're under 80 years of age, you're entitled to go to specific locations, which are spelled out there, and they're basically our hospitals and specialist treatment. For if you're under 80 and you don't meet one of the specified conditions that are stated there, you can actually use the next part that I'm going to talk about, which is our reimbursement process, but we'll come to that shortly. So if you require a book-half driver service to get to and from your medical treatment, it's just a matter of contacting DVA, and I can give you the numbers later in the question time. And you can call us. We'll go through a short call with you and book the transport for you. And once you've attended your treatment, if you've been to, say, your GP and once you're ready to go home, you contact us again and we'll send another cab to come and get you. So for those who have a white card, you need to be travelling for your accepted disabilities only. For the next one, please, Caroline. So our reimbursement process. This is probably what gets used the most with us. It's a matter of you taking yourself to your medical treatment, and the eligibility is the same as for book-half driver. Well, in the fact that if you've got a gold card, you can take yourself to any of your medical treatment as long as you're attending your closest provider, and we'll reimburse the cost, whether it be via you drove yourself, you caught a cab, you caught the bus, or caught a train, public transport. You need to submit a claim for that, which is on our D800 claim form, or you can actually submit it online through your DVA My Service account. So if you submit your claim, once your claims come into us, we'll process them and we'll calculate your expenses, and we'll get the money into your account within 7 to 10 days of processing the claim. Next one, please, Caroline. Similarly, for people with Merck and DERCA eligibility, we do provide the same, except the Merck and DERCA veterans and war widows are not eligible for the book-half driver service, but they are eligible to claim their claim reimbursement of their travel to and from all the same medical appointments, as long as they're attending their closest provider. The other part of our transport that we provide is our flights. So for those of you who live in country or regional areas, and it's too long a trip to get to and from treatment. So if you need to fly to Sydney or to Brisbane or Melbourne for major treatment or for treatment, to specialist treatment, we'll actually arrange for you to travel by long distance train, which is not our preferred. We prefer for people to fly because it's much simpler and much easier on the person and the patient who's doing the travelling. So we'll arrange for you to fly to and from, and as part of that, we'll also reimburse you the costs of accommodation and associated meals, and that will also go to this reimbursement of meals and accommodation also is payable to veterans who are claiming treatment driving to their medical treatment. If they're travelling over 300 kilometres, we'll reimburse 300 kilometres one way. We'll reimburse their accommodation and meals as well.
Sorry, Jonathan, to interrupt the presentation.
That's okay.
I have a couple of questions of people asking.
Yes.
I thought I'd ask now so you can clarify.
Yeah, good idea. Yes.
What is MRCA and DRCA?
Okay. Merck is a Military Rehabilitation Compensation Act. So that is for more of our more contemporary / younger veterans, and DERCA is the old Safety Rehabilitation Compensation Act, but we changed that to make it the Defence Rehabilitation and Compensation Act. So they're not specific. They're all processed under DVA now, and they're just a different acts of compensation where we pay compensation and access for veterans and widows to access entitlements. That cool? Okay, so we've done flights. So the next slide, please, Caroline. Okay, here's an important one for us. For eligible veterans, as I said, with gold card or white card, we do provide an ambulance service. So we don't actually provide the ambulance service. We contract with the state authorities to provide the ambulance service. So if you're a veteran, gold card holder, white card holder, you're in an ambulance, and then the ambulance service does not bill you. They will bill us directly. We work with them, and we pay them on a monthly basis for all veterans and war widows who use ambulance service. So we can take you to and from as in an emergency with all the bells and whistles of the ambulance going if required, or we can also transport you under the non-emergency provisions where if you're unable to transport to and from say for hospital via a taxi, via our book car driver service, you need a bit more care and you need to go in the non-emergency ambulance, we'll also pay for that as well. And Karen, I think that's me, and I'm up to questions, please.
Okay. I do have a couple of questions already on the chat, which is
yes.
So what happens next year when all acts go under one act?
With a bit, hopefully, if we've done our job well, which I expect we will. It should be very seamless to the veteran community when we try and change over to the One Act, to the vets legislation next July. We aim. The good news is for those who are under VEA, the rates of payment that you will get in your reimbursement and also for accommodation and meals will go up to the same level as what the Merca-Durka is at the moment, and because the Merca and Durka at the moment is a little bit higher, especially the kilometre rate. Instead of, I think in VEA it's 48 cents at the moment, and with Merca-Durka it's about 65 cents. So it's a bonus for those of you who have VEA eligibility, but that we're aiming that it'll be a very seamless process next July.
Okay, thank you, Jonathan. I have another question. What if widows cannot afford the cost of the transport to medical appointments?
Yep, that's what we do. It's just a matter of contacting us, and I'll give you some numbers and email addresses to contact us in a little while. But if you're unable to get to your medical treatment, that's what we do. We'll work with you to get you to and from your medical treatment. The last thing we want is for people not to be able to attend their medical treatment due to financial issues.
Okay. Thank you, Jonathan. I have a very specific question. If a gold card holder traveling with their carer in a remote location is taken suddenly ill and referred by the local medical practitioner to a metropolitan hospital for urgent treatment, and they pay their own airfares, can they claim reimbursement of the airfare? And a supplementary question to that is, can the carer flying to join them in the same location receive reimbursement as well?
That is a very good question, and it's too hard to answer here. But I'm happy to answer that specifically because there's a lot of different ways to go with that. If veterans are travelling, our number one aim is to get them to appropriate medical care. And if they need their carer with them, we'll also provide that as well. Okay. But happy to go for the person who asked that question, for them to contact me or contact our email later, and I can give a more specific answer.
Okay, perfect. All right. Thank you very much. So I have a question from advocate. So we currently submit D800 forms via email for our beneficiaries.
Yes.
Would we be able to do this via MyOrg, or if we were registered with MyOrg?
You can do that under my service, submit them on behalf of the veteran, but you need to go and my apologies, I don't know the process, but if you talk to Van, they'll be able to arrange for you to have like an authority to work to access a veteran or war widow's MyGov account to submit claims on their behalf.
Okay. Thank you. Thanks, Jonathan. Is a war widows with a gold card cover for emergency transport?
Certainly. That's the easiest answer ever, certainly.
Okay. Thank you. What is the DVA form number for claiming services?
Here's one I prepared early for you. If you've got a pen, I can write this down. I can call this out.
Yeah, sure. Go for it.
1-800-555-254.
254.
Yeah.
Perfect. All right. I will send this through as well. Now, does emergency, non-emergency transport cover someone with mental health concerns to get to a facility?
It certainly does, and whether that be via a book car driver service or whether it is through the ambulance, either emergency or non-emergency, that certainly does, as long as they have that, they're eligible with gold or white card.
Thank you. Someone has been told by DVA Transport that they will take all war widows to medical appointment regardless of age. Are you aware of this change?
There's no change at the moment. It may well change, but we can transport, and I didn't go into this in my presentation, but we can transport people who are under 80 under book car driver to all medical treatment, but we need some justification. So we'd need to get a letter from your doctor as to specify as to the reason why you can't use public transport or transport, you arrange other transport, or if there's a financial implication that or financial hardship, we're also looking into that as to providing the transport to and from all the medical treatment.
Thank you.
And that's just an individual case by case basis. So it's just a matter of contact us, have a chat to us, and go through the process.
Okay.
And we tend not to knock them down.
All right. Someone is mentioning that taxi services aren't always reliable. So is the department looking at other options such as ride shares or hire car services?
Look, we do have some hire car services contracted to us at the moment, and always have had. From that fact, we're currently not looking at ride share, but we are working quite diligently with our contracted taxi providers to try and ensure that the quality of service we get and that we pay for on behalf of the veteran community meets the standards that we expect and also that the veteran community expect.
Okay.
I know that's not much of an answer, but that's what I can. That's all I can
Provide. Yep. Now I do have. Okay, so the person who asked for the number earlier for the service claim, rather than a phone number, what is the actual form number to submit the claims? Jonathan? I think the connection has left us. We will get back to the question. Now, we'll get back to the question a bit after when Jonathan's connection is restored. So I will now invite Melanie to provide us with information on the Veteran Home Care Program. Thank you, Melanie.
Thank you, and thank you for having me here today. So as mentioned, my name's Melanie. I look after the Veterans Home Care Program in DVA. Just for a bit of background, I've been in DVA for about 25 years. So yes, quite a long time, but I'm still here, so obviously enjoying my job. I'll start just going through a bit of a slideshow, and as Caroline has said, please, any questions, just pop them through on the chat. Okay, so what is Veterans Home Care? So VHC, as we lovingly call our program, VHC provides in-home care and support services which are designed to assist those who wish to maintain their independence living at home with some practical help. What does that mean? So there's a few different service types under VHC. So our most common service type that we provide is domestic assistance. So that's your house cleaning. Generally, we offer weekly or fortnightly services. We also have personal care. So I'll go into a bit more detail on the next slide of what tasks come under each service type. The personal care is non-clinical. So we look at around 1.5 hours a week, and that can be broken up into 3 separate visits. Home and garden maintenance. So this is another popular one in the program. So Veterans Home Care is legislated under the Veterans Entitlement Act treatment principles, which means that there is a legislated limit of 15 hours per year that you're able to access. We also have respite. So we have a couple of different types of respite. We have in-home respite, residential respite, and emergency short-term home relief. As you can see there, again, there's some limits, and these are legislated limits on what you can access per year through Veterans Home Care. And in addition, we have the social assistance program, which is through the Coordinated Veterans Care Program, and that's managed mostly through the community nursing program, but I'll go into a bit more detail. Okay, so some of the tasks under each of our service types. So as mentioned, domestic assistance is our most commonly provided service type. So that's your house cleaning, dusting, vacuuming, making beds, dishwashing, doing some washing, hanging out in the line, could be mopping and some internal window cleaning. Personal care, as I said, non-clinical. So this is to just help with some eating, bathing, showering, dressing, grooming, stockings, medicated lotions. So these are not exhaustive lists. These are just some examples of some of the types of tasks. For our in-home respite and emergency short-term home relief, it's the tasks that are normally undertaken by the carer within the home. Now, social assistance, as mentioned before, that's through the Coordinated Veterans Program, and that is all to do with the community-based socialisation, so going out to activities where you get those socialisation. Okay, eligibility for Veterans Home Care. You need a white card or a gold card. So pretty simple eligibility there. I'll go into a bit more detail about how to actually get the services. So accessing VHC, we have Veterans Home Care Assessment Agencies across Australia. If you have a gold or white card, you simply call that number that is on the screen, 1300 550 450. An assessor will take your call. They will confirm your eligibility and they can do an assessment on the spot over the phone with you. Can take up to 30 minutes. So it's very quick to access an assessment. What happens is the assessor determines the needs for services and then will allocate those services to our contracted providers. So we have about five assessment agencies across Australia and approximately 180 service providers across Australia as well that we manage. Co-payments. So with some of our services here, there are some co-payments that clients are expected to pay. As you can see here, domestic assistance, we have a $5 co-payment per hour. But we do have caps or limits that we have on the services there. So the most you'll pay, even if you're getting, for example, 2 hours a week domestic assistance, you'll only pay the $5 co-payment. Personal care, also $5 an hour. And even if you're getting more than the 1 hour per week, the max you'll pay is $10 per week. Home and garden maintenance, again, $5 per hour. We're pretty consistent here. Now, as mentioned before, there is a limit of 15 hours per 12-month period. So the maximum you will pay if you use all those hours is the $75. Social assistance, again, $5 an hour. Now, respite care, there is no co-payment applicable, whether it's residential, in-home or the emergency relief. Should mention here too that there is a co-payment waiver. So we do have a form available where if there's particular conditions met in our criteria, we will look at a co-payment waiver and pop that in. So you do not need to pay the $5. I can provide the details of the form number at the end of this as well. So this is just a quick recap of the process if you're wanting to access Veterans Home Care Service. So Just by calling that number, you'll get onto the VHC assessment agency that looks after the area that you live in. They can complete a phone assessment on the spot. As I said, takes up to about 30 minutes. If there's a need for services, those will be approved and allocated to a service provider, or if there's multiple services that you require, so domestic assistance and home and garden maintenance, you may have 2 separate providers. What will be sent to you is what we call a care plan. So that details very clearly the assessment agency, their details, what services they've approved and to who, and what co-payments are applicable, and also how much of that service you're getting per week or per fortnight. The VHC service provider will receive notification that they've got a new plan, and they will be in contact with you just to talk about commencement of services, so talk about a day, a time that works for you. The next thing that will happen is the services go in, they happen, the assessment agency will call you at the 6-month mark from the initial assessment to do a review. So that's just to make sure that, you know, if there's any changes in your circumstances, we can adjust the services accordingly. If there's no changes, they just renew the plan or the services as is. And that cycle just keeps happening. Like I said, you can call any time, though, if there is a change in your circumstances within that 6-month period. So it's just a matter of calling that 1300 number up the top there. We do have information available on the DVA website, so the link is there, but I'll make sure that gets out to everyone as well. And the most important thing is that assessment agency number. So our assessment agencies, they can answer any questions for you. If you'd like to see and confirm your eligibility and have an assessment, that's the key number to keep. What I also have is a 1-page flyer, so I'll give that to Caroline so she can send that out to everyone here today. So that is just a recap of everything about Veterans Home Care, and also has the details of the assessment agency phone number on there as well. So that's the end of my presentation, and if there's any questions.
There's quite a few questions, Melanie. So first question is, can you confirm which act applies to VHC versus HHS?
Yes, sure, absolutely. So Veterans Home Care was established under the VEA. However, your gold or white card doesn't have to be under the VEA. It can be under MERCA. Whereas household services is legislated under MERCA. So your eligibility for household services needs to be from the MERCA Act. So VHC, as long as it's a gold or white card, doesn't matter what act, you can confirm your eligibility through Veterans Home Care.
Thank you, Melanie. Now, I do have a comment about the size of the place. Is there a difference of size? So someone who has a 4-bedroom house versus someone who has a 1-bedroom unit, is that taken in consideration, or is there anything that you know about this, Melanie?
Yeah, absolutely. So during the assessment, questions such as this, your living arrangements will be asked. So if you do live in a household with other people, that will certainly be discussed during the assessment. And what we try and prioritise is the areas that the entitled person uses. So it would be their bedroom, bathroom, even if it's a shared bathroom, if that's their primary bathroom that they use, that's considered part of, you know, domestic assistance. So we put that in, we'd be cleaning that. Common areas, so obviously you're going to use the kitchen, lounge room, dining room. But the questions within the assessment will cover all that.
And would they cover the size of the dwelling if the person lives there alone, for example?
Yes, yes.
Okay, all right, thank you. Now, I just also want to clarify, based on a couple of comments, that those services are available to war widows or dependents who have a gold and white card. Is that correct?
Absolutely. As long as you have a gold or white card in your name,
Mhm.
When you make the call, not a problem.
Okay, perfect. Another question from our Chatswood office. Is there an age requirement to receive this support? So the person asking the question is under 70 years old. Herself and her 2 kids hold a gold card. So can they receive domestic assistance and home gardening?
Absolutely. There is no age limit that you must be to access Veterans Home Care. So Veterans Home Care is different to what I call the mainstream aged care services. So we were talking about the Commonwealth Home Support Program, etc. They do have that age limit of 65 plus. VHC does not have any age limits applied.
Okay. Thank you. Thanks, Melanie. Then I do have a comment from someone who's a participant who you have mentioned that it includes meal prep, but the assessment agency told them no. So how can they fight this, or how can they ask to have this reviewed? What would be
I
the
will
course of action?
provide an email to send to me, and I'll make a call to the assessment agency.
Okay, thank you. My apologies, there's quite a few questions, so I'm just going through as they come. Now, someone from the Chatswood office is as well asking if there's going to be a form, a list of questions, or even just a digital form of the questions that they will be asked so they can be prepared for the phone call.
Look, I can certainly send through an example of the question set.
Mhm.
So it's important to keep in mind when we established Veterans Home Care, it was always with the intention that, you know, it was practical services. So we're not going into in-depth knowledge about your health conditions and this and that. It's just your ability to perform household tasks if you can and can't. So there will be some questions about your health, your mobility, etc. But it's not a very in-depth, detailed health assessment. It is a needs assessment for in-home services.
All right, and you will be able to send kind of those, to us. Perfect. Thank you. Thanks, Melanie. Someone as well from Chatswood office is asking, can we access DVA Home Care and my Aged Care for different services?
Yes, you can. So what we say is we don't duplicate services, but if you want to access, say, domestic assistance through Veterans Home Care and some home and garden maintenance through My Aged Care, yes, you can do that.
Okay, perfect. Then another question about mean tested. So is VHC for widows means tested?
No means testing at all.
Okay, perfect. Sorry. Someone also asking, following on to the My Aged Care question, do My Aged Care recognize our gold card for services VHC does not offer?
At the moment, no. So we are working with My Aged Care colleagues and looking towards, what they do, what we do, and how we can connect a bit better. The best thing you can do, though, is contact our assessment agency. So if there's something that is a gap in what you need in your home, the first port of call, I would say, if you have a gold or white card, is the assessment agency for VHC, because we can provide that more instantaneous assessment and provision of services rather than, there can be a little bit of a wait through My Aged Care.
Okay, perfect. My apologies. Following on to the means tested. So is it age-based, capability-based, working career, etc.? These things are taken in consideration.
We consider everything. There's definitely no age limit.
Mm-hmm.
The only thing you need to access an assessment is your gold or white card. During the assessment, various questions will be asked. So are you able to vacuum the floor? Is there something mobility-wise that's stopping you from doing that? Or, it's needs-based. So it's not just, I'm fully capable, I can do everything around the home, but it'd just be nice to have a cleaner. Veterans Home Care is designed for those who do need their help through mobility, if they're frail, if there's a disability.
Thank you, Melanie. Then a question regarding personal care. What is available if you require daily assistance?
So that's going to be coming up in our next presentation with Caroline. So there is a little bit of crossover between the personal care with Veterans Home Care and what's provided through community nursing. The big difference though is Veterans Home Care is, I wouldn't say limited, but we look at that 1.5 hours a week as what we provide as non-clinical personal care. If you require more than that per week, then that's when I would suggest you need to go to your GP to get a referral to community nursing.
Thank you, Melanie. So next question from the chat office. I believe you have answered this a little bit further throughout the other questions, but just in case you have anything to add, besides white or gold card, are there any other requirements for eligibility?
No, so the eligibility is for an assessment. So as long as you've got that gold or white card, call the assessment agency number, and they will go through the assessment. So again, it's based on the assessed needs. So there needs to be some level of inability to perform these tasks on your own.
Thank you. Thanks, Melanie. Another question, will widows receiving VHC automatically be transferred to the new MRCA and its provision on 1st of July 2026?
So with the implementation of the new Act, there's not going to be any changes in regards to how you access VHC. So even when it changes over, you still got the gold or the white card. So that's all we need to see, regardless of whether it's under the VEA, the MERCA, or the new Act.
Okay, perfect. And following on to this question, another question is, what if there are any changes to services, for example, gardening, the 15 hours, will this increase as of July 2026?
There's no set date for an increase. We were always looking at what we can do in the program to enhance the experience for those accessing the program. As I said, it's a legislated limit. So if we want to go to make any changes to that 15-hour limit, it's a bit of a process through government. Not saying it's not going to be looked at or, ruled out, but certainly with the new Act coming in, it's not going to be in time with that if there's any changes.
Wonderful. Thank you, Melanie. So quite a lot of questions for you, Melanie, today.
That's okay.
Someone is asking, how long after completing the VHC assessment does it take to start receiving services in general?
Sure. So we have contracts that specify that once you have an assessment and the service plan is sent to a provider, they must contact you within a couple of days.
Okay.
So once they contact you, depending on their staff availability, it could be within a couple of days that the services start. Okay.
Perfect. Now, another question for assistance with house maintenance. Does DVA have a list of tradesmen they recommend?
We have a list of our providers that we use.
Mm-hmm.
So that list is available on the DVA website of all our providers. So if there is a preference for a particular provider and they're contracted as per the list on the DVA website, you can mention that to the assessor when you call the assessment agency.
Thank you. Sorry, quite a few comments. No. Okay, I currently receive some of the service mentioned through what was originally the home care, which is now privatized. So the person is asking, could I seamlessly transfer to the VHC service?
So I'm not sure which program previously you're referring to, but if you have that gold or white card, by all means call the assessment agency and we can potentially see if we've got the same provider contracted, and then those services could go through VHC instead.
Okay, thank you. So there's quite a few comments.
I hope you're all positive.
Clarifying about the size of the house. So the question before, the person has clarified a few things. So home and garden maintenance is 15 hours per year, whether you live in a duplex flat or 4-bedroom home. So the unit has limited windows and gutters, and on the 4-bedroom house, there will be numerous of them. So is that considered in the assessment, or?
Yeah, so during the assessment, the assessor will ask the size of the home or the size of the yard. That's to determine the amount of time they will estimate to complete a service. So lawn mowing, for example, you have places that are a unit with just a small strip of lawn out the back, and then you do have those bigger 4-bedroom homes with quite a large yard. So yes, it will take up more hours from that 15-hour annual limit. But the assessor can help you and work through what's the most important for you to use those hours. So if you do want your lawn mowed and that's going to take up all your hours and that's important to you, that's fine. If you want to have a bit of window cleaning and lawn mowing, the assessor will work with you to try and manage those hours as best as possible. But unfortunately, with the 15 hours, as I said, it's legislated at 15 and does not matter if you live in a small unit complex or in a large home. It is 15 hours across the board.
Thank you, Melanie. And one last question from our Chatswood office. Will we be able to hand in support document for proof in case assessor is subjective?
Look, absolutely. I don't think we've had that many instances, or if any, but we're not unreasonable, and we're more than happy to talk to you and try and work out the best solution going forward.
Okay, perfect. Thank you, Melanie. I think that's always the questions. I think we've gone through all of them today, and that's all the time we have as well. So thank you. Thanks for your presentation. And last but not least, I will now invite Caroline to provide us with information on the community nursing program.
Thanks very much, Caroline, and thank you for sharing the slides on my behalf today too.
You're welcome.
So the community nursing program aims to enhance independence and health outcomes by providing clinically required nursing services to DVA clients in their homes, allowing people to remain in the home longer rather than entering residential aged care or hospital. DVA has a panel of contracted community nursing providers who will assess care requirements and provide nursing services to eligible DVA clients. This includes clinical care such as wound care, medication, administration or assistance, as well as palliative care and clinically required personal care services. So I know Melanie was just talking about veterans home care, personal care that's available, and the distinction being if there's a clinical requirement for nursing, then you can receive personal care through the community nursing program. It's available for gold card holders who can meet, they can receive services to meet any assessed nursing need, while white card holders can receive services that directly relate to their accepted conditions. The services are completely free of charge for DVA clients. There's no caps on services. It is intended to meet the clinical care needs. And while the average age for people accessing these services is around 85 years, the program can be accessed by any eligible white or gold card holder, regardless of age. To access community nursing services, a referral from your GP, treating doctor in a hospital, hospital discharge planner, or a specialist nurse practitioner is sent directly to a DVA community nursing provider. There's a list of providers on the DVA website. Doctors may have providers that they prefer to refer to, but it is up to clients who they would like to use out of that website, out of the panel on the website. Regardless of what the referral says, the services must be based on the client's assessed clinical needs, as assessed by the community nursing provider's registered nurse who will be overseeing the care, and they must be provided in the client's home. Once a provider receives a referral, they'll arrange a comprehensive assessment with the registered nurse, and a care plan will be developed setting out the specific nursing care that's required. The care plan's agreed and signed by the client or their representative, and then care can commence immediately. We find there's not wait times for services, which is a real plus. Sometimes care is for a specific period of time, for example, post-surgery, or it can be ongoing if that's what's needed. The care is provided by nurses as well as personal care workers, depending on the tasks, but all care is overseen by the registered nurse who's also required to review the care requirements regularly. There are some things that are out of scope for the community nursing program. So the aim of the program is to maintain independence, and there'll be times when the most appropriate care environment should be considered, including whether that might be residential care. Respite and supervision are out of scope, including for overnight care. So while overnight care is available, and that can be a real asset for people who are hoping to remain independent in the home, there needs to be a clinical need for that care to take place. Instrumental activities of daily living are also out of scope. So that includes things like laundry, cleaning, social assistance, companionship, shopping, meal preparation, and driving to appointments. Obviously, those aren't nursing tasks. You can access services from other programs, so Veterans Home Care or My Aged Care services, as long as there's no duplication. And I would recommend that if you're eligible and you have nursing needs, that you do receive them through DVA, because there aren't any caps, there's no co-payment or fees, and then I suppose you're free to use other supports a little bit more flexibly. You can find information about the community nursing program on the DVA website, including a guide for veterans, family members and carers. If there are any questions, you can call the van at any time on 1800-VETERAN, or you can email my team directly at nursing@dva.gov.au, and I've put that email address in the slides along with some links for information. We do also have a range of other useful resources on the DVA website that might help veterans and their families to understand DVA services and supports that are available. There's a list there. So there's a guide to living independently, a guide to moving into an aged care home, a guide to better hearing, a guide to living in an aged care home and planning ahead, as well as some videos and webinars that might be of interest. The information booklets can be ordered in hard copy free of charge as well. So I think I was a bit shorter and sweeter than others, but over to questions if there are any.
My apologies. Yes, I do have a couple of questions for you, Caroline, here. Just someone wanting to confirm if there is a clinical need, can overnight care be provided?
Yes, that's right.
Perfect. Community nursing program with DVA is amazing and has helped us and our mom especially. So very much on a big thank you on behalf of their family. So a couple of comments.
Wonderful. I really like hearing that. Thank you for the positive feedback.
You're welcome. I also have another thanks. Someone who said, I would like to thank the DVA and the wonderful services that are available to all widows. This person used the transport services last year and the drivers were prompt and very polite. So this year, this same person has been receiving the home care assistance this fortnight and the cleaners have been wonderful. So yeah, a big thank you as well for all the service received. Wanting to share that with everyone today. So I also have a question about shifts. So why does a shift after 5 p.m. has to be a minimum of 6 hours and you must put them in bed? So what would happen for younger war widows?
Sorry, I'm not sure I follow that, because there shouldn't really be any restrictions around shifts or times. People should be able to access the care that they need.
Okay.
So if there is something funny going on where a provider is maybe talking to a family about shift times and things, and it's a bit of an issue, please email nursing@dva.gov.au. That's my team. And that mailbox is monitored all the time. We don't have a direct phone line, but you can also email and say, please call, and someone will call you. I think it'd be good to work out what's going on with that particular one.
Okay, wonderful. Thank you very much, Caroline. Another couple of thanks for all the services. And another question, are services eligibility reviewed going forward? So are they often reviewed for eligibility?
In terms of nursing?
Yes.
So the RN overseeing the care should be conducting regular reviews. The frequency will depend on the type of care that's being provided. So some clients need weekly reviews because they might be receiving quite complex care, but I'm pretty sure it's a minimum of, don't quote me, I mean, I should probably know this off the top of my head, but a minimum of sort of monthly, there's some sort of contact with the RN. The care should be reviewed at any time if the family or the client identify that the needs have changed. And those reviews can be quite formal, or they don't need to be, because there's flexibility. The care plan can change. The provider can just change the care plan. DVA doesn't, develop care plans. It's not like My Aged Care. We don't do our own assessment. We don't determine the care. That's really up to the health professionals on the ground.
Perfect. Thank you. So someone is asking, can you repeat the email address for your team, please,
Yes,
Caroline?
absolutely. So just nursing@dva.gov.au.
Perfect. Thank you. I believe this is all. Caroline, thank you very much for your presentation and answering the questions. So thanks very much to all of our panelists today for your presentation and the time answering the questions. So we still have some time left for any additional questions. So I do have some on the back burner here, but if you do have any questions that you would like to continue asking or just popped in, if you can put the name of the person you would like to ask the question to of the panelists, and I will address them as we can. So I believe this one was for you, Sharon, at the very beginning. So the form number to apply for rent assistance.
Yep, so the form number was a D for Delta 0515.
Okay, perfect. So I will send this as well. Perfect. And then for the income cutoff amount, the income support cutoff amount, is it per fortnight or per week?
Per fortnight. We always work on the fortnight because we work in a fortnightly cycle of payment.
Perfect. Okay. And the income limits as well per fortnight. Yeah.
Yes.
Perfect. So I believe this question was for the service claim phone number. So the phone number you've just answered, that's fine. My apologies. A question about VHC. So the husband receives a HHS. When the person becomes a war widow, does she revert to VHC?
Yes, simple answer is yes.
Thank you. My apologies, I'm going through a few, just figuring. Okay, does the HSP program affect DVA services?
HSP.
Not too sure about this one.
Maybe home care packages.
Home care.
Home support
I just
program.
asked for more information.
Thanks.
I thought you might understand. That's fine, not a problem at all. A question for Melanie. So can you receive HHS for one injury and get VHC for a different injury?
So this is where it gets a little bit tricky. If you are receiving HHS, any type of service under HHS, we can't duplicate or get services under VHC. It's one or the other. So household services, access to those services based on your accepted disability, whereas Veterans Home Care, we're based on the card eligibility.
Okay, thank you. Now there is also a question if the attendees will be receiving contact details for each of the panelists today. So I just want to double check with everyone here with all the panelists. I will get a contact email for your teams if that's okay, and also share maybe your slides with the attendees today.
Of course.
Wonderful, thank you. Now one last question, does DVA provide any services for residential care?
So we can provide residential respite through VHC. In regards to placement in an aged care facility, that's through the My Aged Care program.
Okay.
Can I jump in as well? I think having said that, your gold and white card status still applies if you're in residential aged care, and you should be able to access your medical treatment in the same way. In-home care services like Veterans Home Care and community nursing won't apply because you'll be in a residential care facility. And in particular, those facilities are required to meet all the clinical care needs of the people that live in there. If there's a situation where that isn't happening, that's something that can be reported to the Aged Care Quality and Safety Commission. We have come across matters like that, which is why I go as far as saying it, because it is their right to receive that care. Thank you.
Thank you. Perfect. Well, I believe this is all for questions, and this is all for today. We are a little bit ahead of schedule, which is quite rare. We expected sometimes to go over. So again, thank you very much to our panelists and for those insightful presentation and sharing of information. And thank you for taking the time out of your day to provide us with all this information. This is greatly appreciated by all of us. I'd like to thank as well our audience for tuning in and to our team in the background for making this webinar possible this afternoon. And thank you once more to our panelists and all of us watching today. A recording of this webinar will be available shortly. And as mentioned, I will be sharing with all of our attendees the slides and contact detail for each panelist teams as well. Appreciate your time and attention and wish you a lovely rest of your day. Thank you.
Thanks, Caroline. Thanks, everybody.
Thank you, everyone.